ignore all of this, so yeah, then that is the goal.
That is a good one, because I didn't know that one.
Yes, yes.
So my name is Paul Bukuluki, and I'm the research director for Agents for All.
Okay. Okay. So I think you have come from actually a very good session that has prepared you very well for our conversation.
Oh, I'm glad.
So for our first question, I'm going to ask you, this concept of agency that we talk about in relation to Agency for All, could you tell me what's your understanding of that in your own words?
Agency is a fascinating concept for me, and I always understand it by reflecting on myself. The time when I had to make certain critical decisions, and that what helped me to make those decisions is that I was aware of a number of options that were available to me, and I was able to think through, yes, these are the options, but also these are the constraints that I have for the options I'm going to take, and these are the enablers. So I was able to negotiate, thinking through the enablers and thinking through the barriers or constraints, and then I made a choice, and then I was able to mobilize the enablers in order to be able to take action on the choices I've made. So for me, agency would mean making a conscious choice among different options, setting my goals about that choice, and making sure that I mobilize my inner abilities and external resources to achieve the goals I've set by taking action. I had to think through who I am, my family values, my community values, the norms around me as I was making these decisions. So where I come from, it is difficult to define oneself as an individual who is separate from the family and community. So I am an individual, but I'm also family. I have family within me, and I carry my community within me. I think that connecting with the Global Learning Collaborative to learn more about norms was very empowering in my career as a researcher, to know that I have to that when I'm thinking about conceptualizing research on social behavior change, I need actually to think about norms. Yes, individuals, but individuals live within a space where they interact with others, and that these relationships between individuals are regulated by social and gender norms. My research has really improved with the increased capacity to conceptualize norms and how they regulate the behavior of people in groups and in the community, but also to understand that even when I'm thinking of increasing people's capacity to act and uptake behaviors that I may think that are important for their well-being, that it is important to think even beyond norms, because there are also other factors beyond norms that are very important in influencing behavior. Like maybe people's norms around family planning could shift, and people might be ready to use family planning, but then the family planning services are not available. The health workers to facilitate management of myths and side effects are not available, or they are there but not skilled, or that there is stockouts of supplies that are required. So thinking through the fact that yes, even as I think of increasing individuals' capacity to exercise their agency, I have to think of the norms that could be either facilitating, because there could be positive norms, supportive norms, those that would be constraining, but also other structure factors that are very important within this ecosystem. We need to think of the relationship between individual agency and collective agency, and then norms. And we can think about tools to help us check that. We know that the environment keeps changing, so if we also adopt collaborative learning and action measures that help us to track the changes happening in the environment, in the context, as this person is making these choices and trying to act on these choices, I think that would help. That means that my voice is being heard, and that I feel confident to, to say what I think is important, and to share what I'm learning, and that the other partners I'm working with are able to engage with me in a discussion. They don't have to necessarily accept what I'm saying, but at least if we can engage in a reflective discussion about that, and we make a deliberate decision to take up what I'm sharing, or not to take it up, but when I'm convinced that my voice has been heard. And also it is when I feel that my voice is not my voice, but it is rooted in evidence that I've collected from the target audiences that we are trying to change, such that I'm not making up my things and sort of expressing my voice, but sort of synthesizing evidence, human stories, for example, that I've got from the target audience, and then I'm speaking to, say, other partners, I'm speaking to the funder, I'm speaking to policymakers, and we are able to think through this and take action that would enable my target audience to achieve their goals they are setting to change behavior. I think it feels, on one hand, good as a facilitator of that process, but it also creates anxiety if there is no room to share what I'm learning from the target audiences, or if the target audiences have no voice, if there is no platform where even the other partners can hear from the target audiences, such that I don't struggle to say things that another person might doubt. So if there is a triangulation, yes, I package this information I've learned, but there is also a chance for people to check with the target audience. I feel more confident that, one, I'm not misrepresenting the voice of the target audiences, but people can validate what I'm synthesizing, such that when we take decisions, we are sure that this is what the people think, this is what they understand, these are their needs, and these are the barriers, and these are the choices people are making to have a good life, whether this is in terms of SRH or reducing violence or HIV prevention.